Hello, everyone. So welcome to our HALO TRIBRID laser event. We're going to wait a couple minutes, give some people time to log in before we get into things. Welcome, welcome. All right. Okay. All right, well, we're going to get started. So I'm very excited for this presentation and to teach you guys more about our TRIBRID laser. So we'll get into things. So for those of you who I haven't had the pleasure of meeting, I'm Marissa. I'm one of our aesthetic nurses here at Quintessa Mequon. Little background about me, I've been a registered nurse for 9 years now. After graduating from nursing school at Marquette, I worked in the hospital setting for several years in med-surg, ICU, and then I made the switch to dermatology, where I got my start in aesthetics. That was about 6 years ago now, and I've been with Quintessa for 3 years. I do all of our laser services at our Mequon location. I do our injectables here too, and I absolutely love what I do. I feel super lucky to have access to so many tools to help me instill confidence in my beautiful patients. So, and then little reminder, we have 2 very exciting promos for today. So stay tuned till the end of the event to learn more about those. But without further ado, we'll get into things. So what is the HALO TRIBRID laser? What's all the hype about? So the HALO TRIBRID is the world's first triple wavelength resurfacing laser. So what that means for us is that we're able to treat multiple layers of the skin all in one treatment. So because of this, we're able to address a variety of concerns, again, all in just one treatment, from sun damage, evening skin tone, giving an overall skin rejuvenation. It's also nice because we have pretty minimal downtime compared to other resurfacing lasers that are out there. The TRIBRID is also super safe. It actually measures the skin temperature while we're going, so it only fires if it's safe to do so. And it's also super customizable. So the providers are really able to tailor each treatment to each individual patient and their specific goals. Okay, and let's talk a little bit more about how it actually works. So like we said, we have those 3 different wavelengths. So to get into, the technology behind those wavelengths, the first one is actually creating little injuries superficially in the skin. So that's going to help with superficial texture like pores, kind of give an overall evening to the skin tone. Our second wavelength is going kind of in the mid-depth, and that one's creating heat injuries in the layer it's treating. And so that one is actually treating where our deep stubborn pigment lies, so things like melasma, stubborn age spots, treating those. We also get some improvement in superficial texture too, so even more polishing to the skin. And then our third wavelength is going deeper into the skin. That one it's also creating heat injuries like that mid-depth one. And with that one, we're going to get even more deep dermal repair. So think things like lines and wrinkles, scarring, kind of those even deeper textural effects. So going to help polish the skin with that too. Okay, and then I love this visual because it really shows all of those wavelengths all in one. And I like this too because some of us might have heard of our traditional halo or might have even had traditional halo done before. And so this kind of helps, at least for me, visualize the difference between traditional halo and our TRIBRID. So with traditional halo, we had that shorter wavelength all the way on the left, and we had that longer wavelength all the way on the right. So we're treating, pretty superficially, and then we're treating that deep dermal renewal. But you can see now with the TRIBRID, we have that middle wavelength. So it's treating that whole layer of skin that we weren't able to treat with our traditional halo. So opens up a whole array of concerns that we're now able to address, again, all in one treatment. So very cool. And then this is another really nice visual, kind of shows those steps again, what each is treating. I like it too because you can see the laser itself actually creates little channels in the skin. So we're still leaving some healthy, skin tissue behind. By doing this, we're able to reduce that downtime. So still get amazing results, but with minimal downtime. Okay, so where can we use the HALO TRIBRID? In theory, we can really use it anywhere on the body. Our most common areas that we treat are, of course, the face, the neck, the chest. We get really good results on the hands too. I feel like that's an area that we tend to neglect. We can use it on the arms, the legs, you name it. Okay, and what does it do for your skin? So we've touched on this a little bit, but just to kind of go through everything fully. So it's going to help with sun damage. So any deep sun damage, any deep discoloration, like we said, melasma, stubborn age spots, things of those nature, any fine lines, deep lines, any signs of aging really, as far as lines and wrinkles go. It's also even going to even out the texture. So think pores, really just giving a nice polish to the skin. This also goes on to the dull skin. So really just giving a nice glow to the skin. Results are going to be smoother, brighter, clearer, and healthier looking skin. Who's a good candidate? So the nice thing about HALO is that we can really treat all skin types, all skin tones. So almost everyone can, be a candidate. Of course, there's always outliers. So I always recommend consulting with any of our laser providers just to ensure that, it's a right fit for you. But if you have any, deep pigment, any kind of textural concerns that you want to address, this is going to be an excellent treatment. Okay, so what does it feel like in our downtime? So the treatment itself, it's a little bit warm, prickly, kind of feels like a little staticky sensation with a lot of heat. That heat lasts for about a couple hours after the treatment, and then it just kind of dissipates, a little bit smoother sailing from there. So our skin's still a little bit red, a little bit sensitive for that day of the treatment. By day 2, we're starting to see our mends. So mends are basically microscopic scabs from all those injuries that the laser created. It's just making its way out for that new healthy tissue to take its place. So it feels kind of dry, sandpapery in texture. It kind of looks like you smeared coffee grounds on your face. We start to see those around day 2 to 3, and they last for, about the week afterwards, but they slough off during that time. So by day 4 is kind of the worst of it. We see some swelling, redness for sure, varies depending on the person. And then by day 5 to 7, we're starting to get that sloughing, starting to reveal that nice glowing skin beneath. So results-wise, we start to see that initial glow. We call it the HALO glow that week afterwards. And any textural improvement we'll start to see for weeks after the treatment. It's kind of the gift that keeps on giving. We'll continue to see improvement in texture for really months afterwards. So it's pretty amazing. Okay, and a little honorable mention for BBL Heroic. So BBL, it stands for broadband light. So it's a light treatment as opposed to a true laser. And so what it does is it uses different light wavelengths to address different kinds of pigment in the skin. So it's really good at evening out the skin tone. So I think of it to treat any like reds, any underlying redness, rosacea, broken blood vessels. Also really good for more superficial sun damage like freckles, spots from the sun. We get a little bit of collagen production from it too, which is never a bad thing, but primarily we'll see that evening of skin tone. So I love pairing it with the TRIBRID in particular. Because we kind of get a little bit best of both worlds. The TRIBRID's really going to address that deeper, can get some deep pigment too, but really going to be addressing texture, whereas that BBL is going to be like the cherry on top, just kind of evening things out as far as reds, superficial browns go. So they really complement each other well. That's my favorite treatment to do, the two of them together. I feel like nothing beats the results that we get with that. All right, time for a little poll. Okay, so everyone feel free to share. Let's see. So what bothers you the most about your skin? Is it texture, sun damage, fine lines, dullness? Feel free to select and share your vote. Okay, cool. So luckily, if any of those concerns, if you picked any of them, the TRIBRID can treat it. But I want to go through and show some before and afters and just kind of show you guys, what it can really do. So you can see with this first one, this patient, if you look closely, she looked pretty good to start, but she definitely had some unevenness, some kind of deep pigment and sun damage, it looks like. But you can see in the after picture, like, amazing. Her skin is glowing. I don't see any kind of discoloration or anything in sight afterwards. So she got a really amazing result with her treatment. And then this patient too, you can see more so uneven skin tone, not too much texture for her, maybe a little bit in the forehead area, but you can see again in the after picture, just stunning. Okay, and this patient, this is a good example of like that deeper pigment. So you can kind of see that kind of around her eye area, has some texture too in her cheeks. And then you can see in that after photo, again, everything is polished, everything's even. I don't see any kind of texture or pigment remaining, so it's incredible. Okay, and this is a good example of someone that would benefit from both tribrid and BBL. So this patient, you can see she had a fair amount of freckling, more superficial pigment from the sun. So they did a combo of tribrid and BBL for her. And you can see afterwards, again, no pigment in sight. You can see some improvement in texture, especially around her mouth area. Yeah, beautiful. Nice, beautiful, glowy skin. And then this is a good example, again, another tribrid and BBL combo treatment. Has some more redness, again, not too much texture, but I can kind of see some deeper sun damage that they totally corrected in the after photo. Okay, and then we have a little demo for you guys to take you through the whole process. So when you come in, you get checked in, we bring you back to the room. Once I bring you back, I always like to reconsult and just kind of review the whole procedure, make sure we remember everything to expect during, after, all of that. We review our goals for the treatment as well. And then we go through our consent form, so going through any risks and considerations with the treatment. And then after that, I usually have everyone, we'll wash your numbing cream off. So you can see we're doing that now. So with the numbing cream, we have our patients numb beforehand. We like to put that on for about 45 minutes to an hour before the treatment. You get the numbing cream from the office, and you can either come in an hour early and put it on in the office and just kind of hang out with us for that time, or most of my patients will come in a day or two before, pick up the numbing cream from their office so that they can put it on while they're still at home before they come in for their treatment. And it really helps with the discomfort of the treatment. So it's nice to do that. And then we just wash it all off, get a nice warm towel, and then we go take our before pictures. So these are super important. We like to have these so that when you come back in for your follow-up a few weeks after the treatment, we have those to look back on. And then we start the treatment. So here you can see I was facial mapping. We do that to get surface area of the skin. So that helps provide a more accurate treatment on our end of things. And then we're going through the treatment. So we split the face up into 4 sections. And we do a couple passes to each area of the face. We kind of do the bottom quadrant and then the top quadrants. And you can see the skin starts to redden pretty immediately right after the treatment. We just kind of go from there. Just do a few passes, kind of back and forth. I give you guys a cooling wand to use. So you have a cooling wand that you can control where you use it. And then we also have cold air blowing from the handpiece as well. So again, really helps with that heat that we get during the treatment. Beautiful. She did such a good job. And then after, I do a nice post-care mist to really help with that cooling, and you get a little bit of that mist to go home with you too. And then we put a nice calming cream on, again, just to kind of cool things down. And then after that, you're pretty much set for the night. Before you go, we obviously go through post-care, so we'll go through that. very simple afterwards. We don't have you do anything to your face that day of the treatment. Starting the day after, we have you wash your face morning and night with a gentle cleanser that we send home with you, followed with a nice gentle cream, again, that we send home with you. And then during the day, we have you put some sunscreen on. You can see here's a little bit of the clip. So it has that cleanser, the moisturizer, and then that nice cooling spray. Okay, time for another poll. Okay, so would you do this treatment? Yes, I need one. Tell me more. Nervous but curious, or no way? I'm putting yes, I need one. Okay, I'll give everyone a second to answer. Yay. Okay, and then we'll go through some questions. So here's some frequently asked questions that we get. The number one being, does it hurt? So we touched on this a little bit. The treatment itself, it's a little spicy, but we definitely do everything that we can to make it as comfortable as possible. The nice thing about it is it's fairly quick. The treatment can be done in 15 minutes or less. So while it's, not always the most comfortable, everyone tolerates it pretty well, gets through it well, and then nice recovery afterwards. How long does it last? So I'm assuming this means the results. Results-wise, it's nice because in theory, we're stimulating our body's own collagen production. So in theory, the results are permanent, but it's not going to keep up with our natural aging process. So we generally recommend doing it once a year, maybe every other year, depending on your age and our goals, but something that's very patient specific. And then kind of going on to that, how many sessions do I need? Also very patient specific, depends on our goals and what we're treating. If we just want, a general skin rejuvenation, maybe we'll get excellent results in one treatment. If we're treating any deeper texture concerns like deep lines and wrinkles, acne scarring, we might want to do 2 to 3 sessions. We space those out at least 6 weeks apart from each other, and kind of go from there. And then when will I see results? We talked about this a little bit too, but we should start to see that nice halo glow about a week after the treatment. At that point too, we should see improvement in any pigment that we address during the treatment as well. And then any deeper texture we'll continue to see results of for weeks and months after the treatment. And then is it worth it? I mean, short answer, yes. Long answer, of course, it depends on your goals. So again, I always recommend consulting with any of our laser providers to ensure that it's the right treatment for you. But in general, I think we all want clear, glowy skin, and the TriBrid is going to provide that for us.
Okay, now we're going to be answering some questions. So the first one is, if I've already purchased a halo that I haven't used yet, can I upgrade to the TriBrid procedure and just pay the cost difference?
Yes, absolutely. So you would just let us or our scheduling coordinators know, and we can take care of that on the back end to swap in your already prepaid halo for the TriBrid. Great question.
I've had a halo at Quintessa in the past. How is this different? Would you consider it stronger?
Yes. So I know we talked about this a little bit. Both are great treatments, but what's nice about the TriBrid is we have that third wavelength. So it's really going to address that, again, that layer of skin that we're missing with the traditional halo. So it's going to be better at really polishing the skin, getting any like stubborn pigment as well, just in that one treatment where, in the past we might have had to do multiple halos or even, multiple BBLs with the halo. So it's really kind of simplifying things.
Does it help with firming?
Oh, good question. I'm always hesitant to say something is going to tighten the skin, but because it is stimulating that collagen production, it definitely does help plump the skin and just makes it more youthful, glowy. So I guess in a way, maybe helping with firming and some texture, but I wouldn't necessarily expect like a big tightening effect with it.
Hopefully I pronounced this right. Does this work for leg creep skin?
Oh, yes, leg creepiness. It can. Kind of depends on how much laxity is present, but what I see, especially on the body, is that it really helps soften that crepey texture. Again, it's not necessarily going to like tighten that laxity, but it does smooth that like crepey appearance of the skin. So it's really good for that.
Can I take ibuprofen before?
Yes, absolutely. So we definitely touched a little bit on this, but we definitely do see some redness and swelling. How much swelling, it really depends on the person. For me, when I've had traditional halo done, I look like a balloon for 4 days. Other people look almost normal the day after. So it's really depends on the person, but things like ibuprofen, Tylenol, even over-the-counter antihistamines like Zyrtec and Benadryl, they can help with the swelling. Ibuprofen and Tylenol can help a little bit with the discomfort as well. So yes, absolutely, totally fine to take.
What is the price?
Good question. So I always recommend talking to our laser consultant or our laser providers because the price can differ depending on what we're treating, what our goals are. So I would recommend doing a consultation first just to get the right price for you.
How is this different than BBL since the additional layer reaches discoloration? Why would BBL be needed?
Good question. I love that question. So with BBL, we touched on this a little bit, but we're treating more superficial pigments. So think like traditional brown spots, even like larger brown spots. We get a good job of lightening with the BBL, but larger brown spots, big flat pigment in the skin, a lot of times the BBL does a good job of lightening it, but we can't get to the base of it. So that's what the tribrid is going to do with that new wavelength. It gets to that base layer of that pigment to really give us a better job of lifting that out. It's also really good for melasma. So melasma is a totally different beast of a pigmentation. And so it's a little bit deeper in the skin, not as safe to treat with BBL itself, but with tribrid, it is safe and it's getting to that exact layer in the skin that the melasma lies and really does a good job of lifting it up.
Can you speak to choosing this versus microneedling?
Yes. So with microneedling, we're still going to get some collagen stimulation. It's basically just creating controlled injuries in the skin. So it's going to stimulate the body to send in its natural healing response. We get lots of collagen and elastin coming to the skin surface. So kind of similar to what we're getting with the tribrid, but it's not going to be as deep. We're not going to reach all those levels of the skin. It's really just going to be that first superficial level. So we'll see with microneedling, maybe some improvement in pores, might see some softening of lines and wrinkles, but it's not getting quite as deep as with the tribrid. So because of that, the tribrid, it's going deeper in the skin. Because of that too, with microneedling, we generally need a series of treatments just to really see any results with it. Whereas with the tribrid, a lot of times we do one treatment and are floored. So just for that alone, depends on downtime and, what works best for you and your goals, but we're definitely going to get a little bit bigger bang for our buck with the tribrid.
Can it be used for under eyes?
Yes. So with the under eyes, we can treat as close to the under eyes. We can safely pull down over our orbital rim here. So we do see really good improvement in under eye texture with that.
How long do you need to stay out of the sun for after having this procedure?
Oh, good question. Okay. So sun exposure, in theory, if we're putting our time and investment towards treatments like this, in theory, we want to be good about sun protection for a long time to maintain the results. But we want to be especially careful for that month afterwards. Really, that first week, we're going to be seeing the first, the most of the healing. So that's the most crucial to be really careful about sun protection. But really, for a month after, our skin is still going to be healing. So we want to be really careful about the sun. Again, it's not saying you can't go outside, but making sure we're putting sunscreen on, being good about reapplying if we're outside for more than a couple hours, even wearing sun protection like hats, things like that.
What age is the halo laser typically recommended for?
Oh, that's a good question. In theory, we can treat really any age. It really just comes down to what our goals are in determining whether it's the right treatment for you. I rarely look at the age and just kind of treat the skin and what our goals are, what we're seeing, and go from there. But in theory, any age.
What locations is this available at?
Oh, good question. This is available at all of our Quintessa locations. So yeah, if you have any questions, reach out to us. We'd love to see you and make sure that this is a good treatment for you in person, talk more, answer any other questions. Yeah, at any of our locations.
Does this take care of spider veins on the face?
It does not. So veins on the face, that's going to be better treated by the BBL. That treats that specific concern with the light wavelength.
If a patient is to buy a large area like the face, do you offer deals for additional smaller areas?
Yes. So typically with our pricing, especially for like the HALO and the TRIBRID, if you purchase a face treatment and we did another area the same day, we generally offer a discount for that additional area if it's done same day.
What about exercise afterwards?
Oh, good question. So I like to hold off for a couple days after the treatment. Typically, I say once that swelling is starting to calm down, maybe we can start introducing some more strenuous activity. But really for the first few days after the treatment, we want to keep things simple, especially that day of and the day after. We don't want to introduce anything that can, introduce bacteria to the skin. So sweating, makeup, we want to hold off. Usually I say until day 3 to 4. Same thing with exercise, but kind of see how you're feeling at that time. If you feel like you want to exercise, go for it. If you're having a lot of swelling, maybe, we hold off so we don't worsen that.
Will this disturb any other treatments that I recently had done, like smooth threads or Botox?
Oh, good question. No. So those kinds of treatments, they're all kind of at different layers in the face. So injectables, especially, those are going deeper into the skin, or not even the skin, they're going deeper into the face. So no, the TRIBRID does not have any effect on those treatments. I actually recommend a lot of times combining any kind of injectable with laser treatments because laser, again, is just going to polish the skin while everything else kind of, restores volume, softens lines and prevents lines and wrinkles. So they all actually work very well together.
Will the old HALO laser still be available and for how long?
Yes, it's not going anywhere. So actually the exciting thing about TRIBRID is with those 3 wavelengths, we can really mix and match all of them. We can use them all individually. We can combine them in different ways. So we will still have traditional HALO. It's definitely still going to be, a good option for certain patients. So yes, it's not going anywhere.
Does it lighten moles?
Oh, good question. Moles, no. Moles are a little bit deeper in the skin. We actually generally avoid treating true moles. That kind of depends on the spot. So I usually say, like, if it's a spot that you're, questioning, is it going to help with that? Definitely see our laser providers will be able to tell you in person if it's going to address that concern. But if it's a true mole, we typically avoid those guys and leave those for the dermatologists.
Do results differ based on age of client?
Good question. In theory, they can, but because we're able to really customize the treatment to the specific age, the specific concerns, we should be getting some pretty good results. Our expectations might differ with the results of treatment, but we're still going to get those same benefits depending, no matter the age.
Do you have a certain time between your Botox injection and then the hybrid being done?
Yes. So we like to wait at least, 2 weeks between any injectable treatments, at least 10 days, I think is what our recommendation is, to really let everything else settle. Again, that's all in different layers of the face, but we want everything to have time to heal before we're introducing another treatment to the skin.
Is it safe to get done if you're on a blood thinner?
Oh, that's a good question. It is. We might just expect things to be a little bit bloodier with the treatment. We do sometimes see some pinpoint bleeding with the treatment. So if you're on a blood thinner, that is something that I would expect to see. Might see a little bit more than, our average person, but yes, that's okay to do.
Okay, and last question, is it safe for someone with rosacea and extremely sensitive skin?
See, this is someone that I'd want to see them in person and probably get a good feel of how their skin responds to any laser treatments. Maybe do a BBL first to test things out, see how things respond before we jump into something that's a little bit more invasive like the tribrid is. But it, in theory, can be used for patients with sensitive skin and rosacea type skin. I'd probably just want to see how the skin reacts before we jump into that.
Okay, so myself, we've been getting a lot of questions about pricing.
Oh.
Do you feel comfortable talking about that a little bit?
Sure.
Okay,
Yeah.
awesome.
Okay.
Let's go crazy.
Okay, we'll talk about pricing. So for our full face treatment, it is $2,500. If we wanted to add on another area, so each individual area is going to be $2,500, but like we said, if you do it the same day, you get that discount. So we discount any additional area by 50%. So say we did face and neck, it would be the $2,500. I'm trying to do mental math. When that come out to? I think about, we'll phone a friend. About $3,500.
Yeah.
2,500 divided by 2. Again, either way, if you come in, we'll discuss all of this in person. We always provide quotes for everyone too, so that you can take those home, make sure it fits into your lifestyle and our goals. But for the most part, $2,500 is going to be for each treatment or each area. Oh, yes.
I had one more question too.
Yeah.
Can you use this laser on tan skin?
Oh, okay. Can we use the laser on tan skin? In theory, yes. We do not want to have any direct sun exposure for at least 2 weeks before the treatment, though. But if there is still some lingering tan to the skin, we can definitely do the treatment. We can, again, do tribrid on any skin tones. So it does not see the pigment itself. It's actually absorbed by water. So that's why it's safe to use on all skin types, skin tones, skin colors. So in theory, if we have a little bit of a tan remaining, we can definitely still do the treatment. We just want to avoid any direct exposure for a couple weeks beforehand.
I think some people are getting confused with the $2,500. Do you just want to explain a little bit more? Like that just covers your full face?
Oh, yes.
And then you have add-ons for other parts.
So the $2,500 is for the full face. If we were treating just the neck, that's $2,500. Just the chest, that's $2,500. So if we were doing, again, face and neck, the face would be $2,500 and the neck would be half off of the $2,500. So it would be whatever that half off price is plus the $2,500 for the face.
That's great. Oh, this is a really good question, and then we'll keep moving. Sorry. How often should this treatment be conducted on your face?
Yeah, good question. Again, it's going to come down to our goals, our lifestyle, how it fits into our routine. But in theory, we recommend doing it about once a year just to keep up with our natural aging process, keep up with that nice glow to the skin. I definitely have some patients that do it more often than that. I have some patients that do it, every other year. So again, really, talk to your laser provider, see what works best for you and your goals and your lifestyle. And yeah, but generally I'd say once a year is a good rule of thumb. Okay. And then finally our promos. So for today only, we have early access to our Mother's Day gift card sale. So for every $100 gift card you purchase, you get a $20 bonus gift card. And then we also have a promo for the tribrid. So if you purchase a full face tribrid treatment, you get a complimentary BBL treatment to add on to that one. So we talked about the benefits of combining those two together. Truly just gives the best skin rejuvenation effect. So yeah, you can click, there's going to be a link in the chat that you can click on. Otherwise you can scan the QR codes and it'll bring you to that link. And then for here too, so this is for the TriBrid promo in particular. So that link is going to bring you to our landing page on our website. And so we just want you to fill out in that bottom section, just say something about TriBrid promo for the virtual event, laser promo, anything of that nature. And our scheduling coordinators are going to reach out to you to get you set up for that promo. Okay, and then again, there's going to be a raffle. So 2 lucky people will be getting a raffle basket that has lots of fun goodies in it, skincare, mugs, all of that. So we'll be announcing those 2 winners tomorrow on Instagram and Facebook. Okay, it was so fun getting to teach you all about the TriBrid. I hope this, got you guys as excited as we are here. If you want to learn more about the TriBrid, learn if it's a good fit for you and your goals, please reach out to us and schedule an appointment with any of our laser providers at any of our any of our Quintessa locations. And we'll get to answer any other questions you might have. And yeah. All right.